My name is Gregory Ashley.
I am Ron Hayden.
DeCarlis, D-E-C-A-R-L-I-S.
My name is Harry Jasper Joyner. The research on it, and then as a result of that, I selected Dr. Bird and went through the tests that are required, hoping that I'd get a chance to have the Tulsa treatment. And then eventually I did.
It was very difficult. I was rushed to the hospital 3 separate times over a period of 6 months. Couldn't urinate, have a bowel movement. It's an awful feeling. They catheterized me on each occasion, and that relieved me. And so then I was able to go home. But the last time I went, they took an MRI of my kidneys, and they were alarmed at the amount of fluid I had in my bladder, which was 1,700 milliliters, which is 3 times normal. And my bladder turned out to be 3 times normal a person. And they called me from the hospital and said I had to rush back. It was a matter of life and death. And I went back and they put in what's known as a Foley catheter. That's a permanent catheter. Not forever, but for the moment, this is how you urinate. Call a friend of mine who worked for Dr. Bird. I didn't know that. And by 7 o'clock the next morning, they had me in their office because they felt it was an emergency. And they taught me everything. What a Foley was, a catheter, how you had to care for it. They got me home care. The fact that you were on one type of catheter during the day and at night you had to change things. And that's all very daunting, especially when you're my age. And eventually, we got to the point she wanted to rest the bladder, and she did a scan on me and said that I had enough muscle that it could be a good bladder, because the opposite is a very difficult situation. You have a catheter on you for life. So I did what they told me to do, and around the 4-month mark, we're getting ready to have this operation where they were going to widen the area in the urethra tube in order to let me urinate properly. And by the way, I've been having these troubles since I was 40 years old and basically did nothing about it. You know, that's the message, is that you got to be on top of it. You can't just let it happen. So we set these surgery down in Ocala, and she did the prostate surgery on me. I was recovering for 2 weeks, and we took the catheter out, and I was like a new person. I was and am as good as I was in my 40s when my trouble started. And if I hadn't have been referred to her or picked up the phone and called a friend of mine, I don't know where I'd be today.
So
not in very good shape.
I felt very comfortable. And so the first day that I went there, I arrived and they did a follow-up MRI, and then I left. And then the second morning I came and they did the procedure after I had been sedated. And then they woke me up and I had a catheter installed. I got dressed and left. And then the next morning I came back and we had a talk and discuss things and how you should treat yourself as you go forward, and I left there and flew home.
Wow.
And after the healing with the removal of the catheter, everything was back to square one. I'm in awe of the whole process and the treatment. I can't be more pleased.
That is wonderful. What was your reaction to the preparation requirements?
Originally I was set up positive based on my history, but I was concerned because I wanted to be able to pass all the tests so I could get the treatment. That was the only deal. But it was standard treatments. You got the blood, the biopsy, and all that stuff.
What post-treatment effects do you have?
I really didn't have anything except the catheter. I didn't have any bleeding and all of the so-called effects from these other procedures. I could sleep, I could eat, I could use the bathroom. Everything was normal, which surprised me. That's why I'm in awe of the treatment.
Oh, for sure. I mean, I said that while it was happening, regardless of what the results were going to be. I mean, I had a cancer scare. I didn't know whether the bladder would work or not work, but multiple times I said to my friend, I said, you know, if I hadn't called you that night and asked you a question, I don't know what would happen to me. Wow. I mean, it was very likely that I would be dead. I mean, my trips to the hospital were gruesome. And so the way things broke for me was really kind of like miraculous, that I would pick up a phone and call a person who I'd represented as a lawyer and became a dear friend, and that she would just happen to work for Dr. Bird.
Excellent. She's very dynamic and she knows what she's doing. Very knowledgeable, and I mean, and people claim that it's painful, but I don't have pain with her, and she tells me what it's going to be, and it exactly how she says.
Okay, and I can tell you that even though I am a child of the 60s, and I thought nothing in the world could ever embarrass me, not so. Apparently I'm an extraordinarily modest person and can blush at the drop of a hat, okay? But thank heavens for Dr. Bird and for her people, because they made it survivable for me. One of the things that they offer, in addition to excellent care, is relationship. I felt like they really cared for me as a person, and when I was embarrassed, they encouraged me. They found a way to help me deal with that in addition to the medical treatment. And so she and her staff, and I don't want to deny the staff, because all of them make me feel very welcome when I come. And so it really feels like it's more coming to a group of friends than it is something else, even though I get excellent care. And like I say, Dr. Bird caught something that was an issue that the preceding urologist hadn't caught in several years of treatment.
What treatment do you have with Dr. Bird?
Well, I, like a lot of men my age, had a very swollen prostate. And so one of the issues became, is this cancer or is this not? And so the first thing that you have to do is you have to go through all the checks. I was very blessed. It was not cancer. Okay, my brothers had prostate cancer, but I did not. And so this is one of those kind of things, if it's in the family, you take extra care to check. And so they checked all that and found out that that wasn't the problem, but the prostate was so swollen that it was causing all kinds of issues. So she had to go in and operate to make room in the swollen prostate. She had to take a lot of the extra tissue out so that I could actually go to the bathroom like a normal person, and so forth. So she has done a variety of processes with me. And then, of course, now it's everything is follow-up. You know, it's like, okay, we've done this, we've checked this, we've checked this. Let's maintain a careful a monitor to make sure that everything continues well. And so I'm in that monitoring. Now, one of the things that has added is that they checked my testosterone levels, and apparently over the years that has gotten low, and so I'm having a testosterone replacement therapy, which she's also managing. And again, it's one of those kind of things that the follow-up in her world is as important as the process of identifying and working on the problem. And so that in turn gives me confidence, and it goes back to that point that I was making. She offers relationship in addition to the treatment, because she's not only concerned that I get what I need, but that also that the follow-up processes so that no side effect or no bad outcome can develop over time. And so it gives me great confidence because I feel like everything's being taken care of and that kind of stuff.
From the very first day, she treated me like family, and it just makes a big difference because I trust her.
Well, one of the things that I am learning, and this is just in my personal spiritual journey, is what I call Thanksgiving therapy. I'm a person who's kind of prone towards self-pity. You know, it can really get in there. I'm sure I'm not the only one. But in my prayer life, I feel the constant urge to learn to be thankful, because when you're thankful, you begin to look for the ways that you have been benefited instead of only focusing on the negative. Well, that's really easy to do with Dr. Bird, and we've even talked about that because I told her I was one of those kind of people that was inclined to, when somebody turns the lights down, to see all dark. And but it's easy to be thankful because, like I say, every step of the way, she's caught, she has accurately resolved and worked on whatever issues were really necessary. So to be thankful for that is just necessary. Now it's needful for me to be reminded to be thankful, but for her it's easy. And because she's done so many good things for me. And so I really do appreciate that. And I appreciate the kindness that she and her staff have always treated me with. I mean, they really do make me feel extraordinarily comfortable. And, but you know, a lot of times you get focused so much on the problem that you're facing that you forget how many people are working to try and help you out. And so, and when you're having bladder problems and all that kind of stuff, it just seems to take over your mind, that you just focus on that and forget how many people are helping, and not only helping, but really helping. And so Thanksgiving therapy is part of my treatment, and the good thing is that it doesn't hurt her feelings for me to remind her that she's done an awful lot of good things for me.
Dr. Bird, you need to continue to expand your practice so that you can continue to help people in this by using this treatment procedure.
She saved my life. She saved my quality of life. Even if I'd have hung on, I mean, what would it be like living in a room, my bedroom, on a catheter? And so she did. And it was amazing how the type of care I've had in the past, how all of a sudden I was welcomed in her office. I could walk in. I would tell anybody, any man, that if you start having problems, I don't care what age it is. I fooled around for 40 years. I'm 86 now. So I had, at 40 years old, my problems started, and I didn't handle them right. I traveled all over the country trying cases. I had a million excuses, and none of them were any good looking back. So if you have a problem, see a urologist, and if you could get in to see Dr. Bird, that's who you want to see.